Good evening. The knee joint's main function is to bend, straighten, and bear the weight of the body along with the ankles and the hips. And knee pain is the most common musculoskeletal complaint that brings people to their specialists. With today's increasingly active society, the number of knee problems is also increasing. To know more on knee pain, the specific causes and treatments of knee pain, we have with us today Dr. Venkataramanan Swaminathan, orthopedic surgeon and knee specialist at Apollo Specialty Hospitals, OMR. Good evening, doctor.
Hi, good evening, everyone.
We mentioned the many possible causes of knee pain. Besides arthritis, what could be the causes of knee pain today, doctor?
So, there are other causes of knee pain than arthritis. Among the commonest causes is tendinitis, bursitis, uh, sometimes a stress fracture, uh, injury or strain of your ligaments, your meniscus, and even the capsule of the knee joint. These, in fact, are quite commonly the reason for knee pain rather than arthritis. Arthritis is a pretty significant long term disease and rarely is the immediate cause of knee pain.
You spoke of bursitis. What is bursitis of the knee?
So, the knee joint is basically made of two bones, three if you actually consider the kneecap, which sits right in front of it's kind of a loose bone in the front, and all of it is covered by tissues around it. Now, to help in the lubrication of certain tissues, there's something known as a bursa. Now, let me explain it to you a little differently. So, you have movement inside the knee joint, so it is inside the knee, but there are movements happening around the knee as well. So, there are tissues which are gliding in and out from the sides. So, nature has given some kind of lubrication between the other tissues and the bone, and that's called the bursa. So the bursa basically is like a sac, and it's got about maybe about 1 ml of fluid in it. So it's a very thin sac, and it allows the gliding. So if you have two tissues like that, and if there's something in the middle, so you will find it glides. That's called the bursa. So there are few bursa which sit around the knee joint, and these can get inflamed either due to trauma or due to some repetitive injury or due to a repetitive action or repetitive posture, and that itself can cause pain and swelling and redness.
We have a question. Hello, doctor. My mom is 72-year-old and is suffering from knee pain. She often consumes Crozin 650. I don't know for how many ever years now. Is there any permanent relief? Kindly advise.
Yes, so considering the age of your mother, which is about 72, I would think maybe for her the first reason of pain may be arthritis. And in her condition, it may be what we call as osteoarthritis, which is basically an age-related condition. You can look at it another way, thinking that maybe the lubrication has gone down inside in the middle of the knee, and that's probably the reason why she's having pain. Well, to advise you on what kind of remedy would give a permanent relief, it may be best if you visit a doctor or a knee specialist, or if possible, maybe come down to Apollo at OMR. Examination and X-ray may tell us exactly what the reason of the pain is and can help you in guiding as to what can give permanent relief. And I can tell you there are various methods, not necessarily surgery. There are other methods by which a person can be completely relieved of pain in the knee, even at that age.
What is a torn meniscus, doctor, or a meniscal tear?
So a meniscus is like a cushion, or like what shall I call a washer, or you might even like a gasket in your pressure cooker. So something like that, like a rubberized tissue, which actually increases the conformity of the two bones of the thigh bone and the leg bone. We have a model here. So this is the thigh bone, and here is the leg bone here. And between the two here, to improve the conformity, you have a rubberized tissue in the middle, and that sits a little loosely. It's not very firmly fixed to either side. It's quite loose actually, and that can sometimes tear itself due to a sudden twisting injury, or just because it's become a little aged and old, it can just tear by itself. That's what we call as a torn meniscus.
We often keep hearing terms such as muscle strain, ligament sprain, ligament tear. Do these lead to knee pain or a permanent knee pain?
So, a muscle strain or a ligament strain is typically an injury to the muscle or the ligament, but it's not fully torn. So, when we say strain, it's like a physics. We bring word from physics into it. So, strain is just a stretch of the fiber. So, type 1, type 2, type 3, we differentiate. Type 3 is where strain becomes a full tear. But before that, you have a type 2 and a type 1, just a slight stretching of the ligaments. And that is something which will heal in probably anywhere from 2 to 6 weeks time. At the most, at about 8 weeks, you're completely out of the pain, and you can go back to where you are. So just to understand a little bit, what's a ligament? A ligament basically is like a rope-like structure which holds the two bones together. So you have the thigh bone and the leg bone. Obviously, they are not just hanging themselves. So there's something which ties them together, and that's like a rope. So you have typically four ropes. Two ropes will sit on the outside of the knee, and two ropes will sit in the middle like a cross. They're called the cruciate ligaments.
Hello, doctor. I'm a 33-year-old female from Chennai. I exercise regularly in the gym with weights, and sometime back I had pain in my left knee. It was fine for a few months and I could do weighted squats, but now again the pain has resumed. I am using a kneecap, a knee supporter, but still I continue to experience poking pain, poking
Okay.
pain
Yeah.
when I do squats alone.
Yeah.
What can I do to reduce the pain? And will an ice pack every day help?
Yes. So the way you describe your activity, you're doing a lot of squats and exercising your muscles. It's great. It's fantastic. Actually, I encourage you to do that. The only thing I think you may not be doing is stretching the muscles. So whenever you do a workout, you have to concomitantly stretch those muscles and even the muscles in the opposite direction. So if you're doing an exercise for your thigh, so like doing a squat, and so the front of your thigh is getting exercised, but the back of your thigh maybe actually not, maybe getting tighter. So you might have to do quadriceps and hamstring stretches. You may ask your trainer about this, and he will probably guide you. So if you do adequate stretching before and after the exercise that you do, your pain should disappear. The second possible reason for your pain can be that you're overdoing. So this is a common terminology we use in sports medicine, is too much too soon. Or, so something which your body is not able to keep up with. If you do squats every day, you might be overkilling it. So maybe you need to step down, go to about 2 times a week or 3 times a week. You got to remember that for a muscle to really become strong, if you do it every day, the muscle will not really become strong. You have to give it rest. So if you do it 2 times a week or even once a week, and the remaining 5 6 days you're resting that particular group of muscle, it actually helps you to become stronger.
Speaking of working out in the gym and lifting heavy weights, how does a person prevent sports injuries as such?
Yeah, so as I alluded to earlier, stretching is critical to make sure that you don't enjoy yourself in any kind of sports, because sports would involve certain dramatic movements, and if you don't have adequate flexibility, it's possible that you can tear a muscle or injure a muscle. And the other thing is technique. So whatever kind of sports that you do, the technique is so important. It's probably far more important than even stretching. Is that the way you jump, the way you land, and and that's equally important. And how you jump. So certain people, the way you jump is So when you land, எப்படி விடுறீங்க, that kind of thing. If you காலெல்லாம் கோணலா வச்சு விழுந்தீங்க, like those kind of things, you can twist something inside. So therefore, இந்த மாதிரி games like badminton, shuttle, it's very common sports. நம்ம நிறைய விளையாடுறாங்க. இதுல வந்து when you take a long step and try to ஒரு பிக் ஷாட் அந்த மாதிரி அடிக்க ஜம்ப் பண்றீங்க, அப்புறம் விழும்போது நம்ம if you're not focused on எப்படி விழுறீங்க, எப்படி நீங்க கால் எப்படி வச்சிருக்கீங்க, you can injure yourself some part of your knee or your foot or your ankle. அங்க எங்கேயாவது இன்ஜுரி வந்துடும். You got to be a little careful about that.
Who or which category of people are more prone to knee pain, doctor? Basically, what are the risk factors for knee pain?
So if you look at risk factors, it starts with aging. So yeah, the more older you are, you're likely to get some knee pain, those kind of things. The younger you are, there's less chances. Second possible reason can be genetic reasons actually. So family history. யாராவது உங்க குடும்பத்துல இப்ப அம்மா அப்பாவுக்கு முட்டி வலி இருக்கு, தாத்தாக்கு இருந்திருக்கு அப்படி இருக்கணும். லைக்லி நமக்கும் வரலாம் அது எனி டைம் ஆஃப் த டே. எப்போ வரும்னு சொல்ல முடியாது. It may come at a younger age or a later age. That is the second possibility. ரொம்ப ஸ்போர்ட்ஸ் சின்ன வயசுல ஹெவி ஸ்போர்ட்ஸ் விளையாடினா கூட, எஸ்பெஷலி ஜம்பிங் ஸ்போர்ட்ஸ், ரன்னிங் ஸ்போர்ட்ஸ், அந்த மாதிரி லேண்டிங் ஸ்போர்ட்ஸ் அதில் வந்தா கூட யூ கேன் கெட் knee pain is a likelihood there. Excessive weight, I'm saying ரொம்ப heavy weight, more than 150 or 160 kilos அந்த மாதிரி, those kind of people also can be exposed to a little bit of knee pain abroad.
Does losing weight help prevent arthritis?
ஸோ லூசிங் வெயிட்னால உங்களுக்கு ஆர்த்ரைட்டிஸ் இல்லை முட்டி வலியே வராது அப்படின்னு சொல்ல முடியாது. பட் உங்களுக்கு முட்டி வலி இருந்து நீங்கள் வெயிட் லூஸ் பண்ணீங்கன்னா, யா, யூ வில் பெனிஃபிட் ஃப்ரம் த லாஸ் ஆஃப் வெயிட். ஸோ ஏன் அப்படி சொல்கிறேன்னா, வி ஆஸ் டாக்டர்ஸ் வி சி ஈவன் தின் பீப்புள் கம்மிங் வித் knee pain. ஸோ இப்போ அவளுக்கு வி cannot go and say go and lose weight. They are already thin. So and obviously the weight is not the reason for the pain under. Probably genetics. So probably family history, genetics. Now we understand, the scientists and doctors the world over, we feel that actually genes are probably the main reason why some person may get the knee pain, other person may not get the knee pain. But once you get the knee pain, weight loss definitely helps.
Hello doctor, my father is 62 years old and suffering from severe knee pain in both the knees, also swelling in the lower part of his left leg. He can't even touch that leg and is slightly diabetic and is taking medications for the same. Kindly advise.
So at the age of 62, உங்க ஃபாதருக்கு சிவியர் knee pain இருக்குன்னு சொல்றீங்க, and he's got pain on one side, the lower part of the leg. This is a very typical case of stress fracture developing due to arthritis of the osteoarthritis of the knee. So knee இதுல என்னன்னா நிறைய worn out literally, and the whole angle has changed. Probably it's a little bit bent like this. This is my left knee and that's my right knee. So it's bent off like that. And the bend இருக்கும்போது you get stress at the lower part of the leg. On the lower part of the leg, because of the stress, the pain, you can't even touch it. So painful. So once you correct the knee, so I feel your father will need surgery. The knee replacement is the best surgery for him. You get rid of that pain. It'll also straighten the leg completely. Once it becomes straight, automatically the stress pattern changes and the legs become straight, and automatically the lower leg pain disappears. You don't have to do anything for the lower leg.
What can I do to slow down the progression of arthritis? Is surgery the only option?
Slowing down of arthritis is best done by exercise. Exercise has been proven that it really slows, probably delays the degradation of the joint. And what kind of exercise, how much exercise, this is something that is not some one answer fits everybody. So each person's body is different, their genetic factors are different, their body weight is different, their having done exercise before in younger age also helps. So therefore how much exercise you can do and cannot do is dependent on your own self, how you feel whenever you do the exercise and how you feel after the exercise. So typically walking will help the knee pain. If you walk for at least 30 minutes, 45 minutes, it really helps. Running a marathon may not be a good idea if you have knee pain. That's not going to help your knee pain. But you can possibly run, few kilometers. That's fine. 4-5 kilometers, it's okay. Then exercising with the weights, or not even with weights, just body weight exercise like squats. Commonly, Tamil enna solrona thopu ganna. Puliyara paathu thopu ganna. That's a superb exercise for the knee joint. It's one of the best exercise. If you do thopu ganna every day, you probably will not get knee pain also. That's also a very good chance. So, if a combination, so one naal thopu ganna, then a few days of walking, and again some thopu ganna, then stretching and yoga. Yoga is a superb, again, benefit for patients with knee pain. One of the best yoga is you've got to do Vajrasana and you've got to do Padmasana. These are the two asanas which are really helpful for anybody with knee pain.
Hello doctor, Is arthritis and osteoarthritis the same?
So yeah, that's a good question. So arthritis and osteoarthritis, it's an English word. So people from the West have told us. So normally, in our culture, these things are not there. So we don't hear it that often. But nowadays, we hear doctors talking about more and more. We need to more about this. So osteoarthritis is something which comes with aging. It is something where the joint lubrication is reduced, probably due to genes, how your structure is and all that kind of stuff. The lubrication குறையதுனால you start getting pain. It's called the osteoarthritis. The second is called rheumatoid arthritis, or what we call as autoimmune arthritis. What is this? So as you know, immune system, that is, we have in the blood, we have red cells and we have white cells. White cells are supposed to fight the bacteria and the virus. They are the defense mechanism. But sometimes what happens, the white cells think that your own tissue is actually a bacteria. So they think the cartilage in your knee is actually a bacteria and they start attacking. So why this sudden change? Why are the white blood cells suddenly started thinking? That nobody knows why this sudden flip in the switch happens. But for some reason this starts happening, and this sets in an inflammatory response in the joint. This can happen from very young people, you can even 5 years of age, 15 years of age, 18 years of age. So it may come at any age, even elderly people, 60, 70 also, suddenly they may start getting this disease. So exact reason why it happened, we don't know. But we know that this is what really happened. And today there is a lot of new drugs which really help in controlling, even some of them even promise a cure also from that. And you may need to meet a specialist known as a rheumatologist for that, not an orthopedic surgeon, rheumatologist. They are the people who deal with this kind of disease. And if you go early to them, it's possible to arrest the condition.
I am 27-year-old male from Chennai. I have been having recurrent knee pain in both my limbs, especially after playing basketball for about 7 months now, and it's actually getting me worried. Is there some permanent solution to this?
So yeah, you said you started playing basketball now, which I can understand is a lot of jumping. So it sounds like, as if you're stressing your knee a little too much. Too much too soon is what I would use here. Maybe you need to stay off basketball for some time, a couple of months, 2 or 3 months. If you still feel even after that your pain is not gone, then you may need some evaluation by an orthopedic surgeon or a knee surgeon. That should take you forward.
What type of activities are most likely to cause knee pain in youngsters?
So as very rightly pointed out, the previous questions was asked, recurrent like sports. Now, why suddenly now? So at the age of 27, so probably is somebody who has finished his education by 23 or 22. So college time, you're playing a lot, and then suddenly there's a 5 year gap, and then you were in a job, you're busy, and now you had some time, you started again playing. So sometimes there's kind of gap things. So your body is kind of out of condition, I would call it, deconditioned. So whenever people suddenly start a sport after a longish gap between 5 years, 10 years, suddenly they pick up a racket. So somebody who was a champion at the age of 25, went to a job, became obese, developed diabetes at 40, then picks up a badminton again. So 15-year gap. Suddenly after 15 years it plays, but in his mind he's still 25. That's the trouble. So in his mind he's still 25. He plays badminton with the same vigorous activity, and he goes about coming with pain. So the important thing to understand for young people is to condition yourself, to warm up yourself, make sure you have the strength and the flexibility and regain all that, and then go into sports. That's probably one of the commonest reasons why people start getting pain at that young age.
How do I know for sure whether arthritis is the cause for my knee pain?
Well, to know for sure whether arthritis is the cause of your knee pain, a simple X-ray can really help you. So even an X-ray can give us signs as to whether arthritis. But having said that, I can't say that it's 100%, but 95% of the time we'll be able to say with just simple X-ray whether arthritis is the cause of knee pain.
Is there a permanent cure to knee pain, doctor?
If you say arthritis is the cause, technically speaking, arthritis has no known cure. You cannot cure it as such in that sense. But yes, you can control the pain with simple measures, and it may even last all your life without having to go under the knife or take an injection or any such thing. But it also depends on the attitude of the person, how the knee pain affects you.
Hello, doctor. I'm 30-year-old male. I've started morning jogging to lose my stomach fat, but after 1 week, I feel a lot of knee pain and it's increasing with the day. I take a Dolo 650, I feel okay for a few hours, and then the pain recurs again. Please advise, I do not want to stop jogging as it gives me a lot of energy, but the knee pain actually pulls me down. Once the pain starts, I'm not able to walk properly, and if I sit on one knee, it's very difficult, and to stand up and walk every day is becoming a difficulty. Kindly advise.
Yeah, so again, so it's
He's also mentioned saying I'm slightly overweight. Could that be the reason? In that case, is there any other option than not stopping jogging?
now I think I like your enthusiasm that you don't want to stop jogging. I support it completely. But there are a few facts we have to face. One is you're slightly overweight, as you claim. And the second thing I think is really that you're not conditioned, you're not ready to suddenly jog every day for, you know. So I think I would cut it down. I would play jogging once a week or even less, maybe for 2 weeks right now, no jogging, and then resume at once a week or alternate day or once in 2, 3 days like that. Give it a gap. Allow your knee to recover. So you suddenly started jogging. Your knee never felt this jogging ever in its life. Suddenly you started insulting the knee. It's going to scream now. So therefore you got to give it slowly. So you do it maybe once a week or 2 times a week. Step it up slowly, and then so what we call as baby bites, small bites. Start like that. Slowly you can increase it. Now, if even after 2 or 3 weeks down the line you feel it's not helping you, then you definitely need to meet a knee surgeon or an orthopedic surgeon who understands knee problems, and then take it from there.
What is the solution for grade 2 tearing of ligament in the knee, doctor?
So a grade 2 tear, as I said initially, was a grade 1, grade 2, grade 3 is the tear of a ligament is how we classify it. So ligament is like a rope which connects the two bones between the thigh and the leg bone. And sometimes due to an injury, the ligaments can get stretched. So if it's a stretch which is not seen on the MRI or it's like barely seen, that's a grade 1, but you're painful there. And grade 2 is where you find some signal changes, but actually there's no great instability of the knee. That's a grade 2. Grade 3 is where it's completely torn off. So for a grade 2 strain of the ligament, now it depends on what kind of ligament it is. Is it a ligament which is sitting outside the knee? So something which sits on the outside of the knee, a grade 2 tear will heal up by itself. You just give it a couple of months and everything is back to normal. But if you have a tear within the knee joint, within what we call the ligament between the knee, it's called the cruciate ligament. So among these two, again, there's a difference. If you have the grade 2 tear of the anterior cruciate or the grade 2 tear of the posterior cruciate, if you have the posterior cruciate, again, nothing much to be done. Couple of months in rest, and then some exercise programs, and you can be almost back to normal. The grade 2 anterior cruciate tear is where it's a bit tricky. It may heal up with exercise, but it's quite possible it may not heal up, and you may still have persistent symptoms. You might then need to take it up with the knee surgeon and understand what else can be done for that.
Is a knee gel helpful for osteoarthritis?
So probably what you're referring to a knee gel is the injection or it's the ointment. I'm not sure.
Just the question, knee gel, is it helpful for osteoarthritis?
Well, if you're talking about a gel, which is an application of a lubricant oil or cream, which is on top of the knee, well, I guess one is better than anything else. It doesn't really matter. But if you're talking about the gel, which is like an injection which goes into the knee, yes, it does help osteoarthritis of the knee. You get relief for about 6 months to a year, but after a year, the pain is back again.
Hello, doctor. My father, aged 63, crossed the road very fast and his leg is now paining for the last 2 weeks. He is not able to walk straight and nor is he able to bend his knee on the knee joint. He says the pain is very bad and is slightly swollen. Kindly advise.
Well, I think your dad may be having a stress fracture or a minor crack or something. I think it would be important to see a doctor, get an X-ray, maybe an MRI scan done, and then only it can be advised further what's to be done.
Is ice therapy helpful to reduce inflammation of the knee?
So if you get an acute injury, like you fell down, and so if you apply ice immediately within the next 5 minutes, you can stop the swelling from appearing. You can stop it from becoming blue. If it were becoming blue, it will even reverse back. I can assure you that if you apply ice. So the quickness of application of the ice is very important there. If you do have like chronic knee pain, which is coming and going, yes, ice application helps. Even hot water application helps there. So there probably doesn't make too much difference whether you apply ice or hot water. It's the same thing. But ice, when you have an acute injury, is absolutely crucial. Maybe your knee, maybe your ankle, maybe your foot. Always put ice immediately. Grab some ice and put it. You will find a remarkable change in the pain and the sense of improvement.
Does it also reduce the inflammation that's caused,
Absolutely,
doctor?
yeah. Ice will reduce the inflammation. So acute inflammation will be absolutely stopped immediately.
So should they apply some gel or some kind of
Gel
ointment and then
ointment. I'm not a big, great, hot favorite for ointment. As soon as you get an acute injury, never rub it because ointment involves rubbing. So don't ever rub it. Just leave it. Put ice, ice, and ice. And that's it.
My mom has rheumatoid arthritis for many years now. After taking her medication, her knee joint pain is almost gone. But recently, she's suffering from a burning sensation in the right side of her ankle joint. And whenever she tries to sit or gets up from a position for walking or anything, she's not able to do it. She hardly walks 100 steps a day these days. Kindly advise, doctor.
Well, your mom's case sounds as if it's difficult to give you an advice on something like this. You may have to meet a doctor, an orthopedic surgeon, and understand what's the reason for this burning pain on the outside of the ankle. Maybe that there is some arthritis which has come back as a flare up there, or it may be that that part of the joint is worn out, or it might be tendinitis, it may be tenosynovitis. There are many conditions which can cause all the symptoms that you mentioned. Best that you see an orthopedic surgeon.
Is a person suffering from flat foot more prone to knee pain? And in that case, what should they do, doctor?
Well, yeah, there has been some association of flat foot and knee pain, though not a strong association, maybe a weak association. So if you tend to have flat foot, you would have to maybe use some supports under the shoe or the chappal that you wear so that the arch is created. So normally people with a flat foot, so everybody's foot has a kind of an arch like this. So a flat foot is a person whose arch is collapsed like that. So you can best see it from the inner side of the foot, not from the outer side. From the inner side of the foot, you see that the arch is collapsed. That's a flat foot. So when you have a flat foot, it has an influence on the top. The next joint is the knee joint, above the foot is the knee joint. So it has some influence there. And so there are some methods by which they give kind of a support under the shoe, under the arch there. So if you ask in your some of the shoe shops will have it. They'll have something known as an arch support insole. You can, it's got a support. It's got like a bulge or a like medai mari on the inner side of the shoe. You can just put it into your shoe and it'll support the inner side, and that can help. The other thing that people with flat foot do is that they tend to walk with like this, like a Charlie Chaplin. But I'm not saying Charlie Chaplin is extreme, but somewhat like most people walk like this. So if you have flat foot, your flat foot is getting worse if you walk like this. If you walk like this, the flat foot actually will improve, and you will feel that your pain actually improves from your flat foot. You could try that and see if it works.
Hello, doctor. The right side of my left knee hurts very badly as soon as I wake up in the morning. What could be the reason? She's 34 years old.
Well, the most likely reason is that the way I understand is you may be in a sedentary lifestyle. You're probably sitting at a desk for hours together, and so that means the back of your muscles are becoming tight, back of the knee muscles, and because they're becoming tight, so you're sleeping in the night, you're inactive again. When you wake up, those tight muscles are again painful. So a course of stretching would really help you, stretching of the hamstrings. So you can look up hamstring stretching on the internet or the YouTube. You'll find a lot of methods how to stretch your hamstring. Start with the hamstring stretch. See how it improves. If it's not improving with stretching, then you will need some blood test and maybe an X-ray to rule out any other conditions. To see what other cause of pain, maybe bursitis, maybe tendinitis.
What would be your message for our viewers today, doctor?
So my message to my viewers today, firstly, I'd like to thank you for all sending me these questions. It was very interesting, a wide variety of questions. I would like to say that please always remember that exercise is very important for human beings. You must regular exercise பண்ணுறது தான் ரொம்ப முக்கியம். இப்போ இருக்கிற காலத்தில் வந்து வி ஆர் மோஸ்ட்லி ரொம்ப செடென்ட்ரி லைஃப் ஸ்டைல். வரோம் போகிறோம் உட்காடுறோம் வேலை பண்ணுறோம் அவ்வளோதான், அப்படியே முடிஞ்சிடுச்சு. காலம்பரம் எழுந்துக்கிறோம், ஓடுறோம் வேலைக்கு, மறுபடியும் வரோம், மறுபடியும் உட்காடுறோம். ஸோ எக்ஸசைஸ்ன்னு எடுத்தோம்னா ரொம்ப கம்மியாக இருக்குது. நம்ம ஒரு டைம் எடுத்து நம்ம பண்ண வேண்டியதாக இருக்குது அதில். பட் இந்த டைம் எடுத்து தான் ஆகணும்னு நான் சொல்லுவேன். இட்ஸ் பெஸ்ட் ஒரு யோகா, ஒரு வாக்கிங், ஜிம்மு போகிறது, கேம் ஸ்போர்ட்ஸ் கூட விளையாடலாம். ஆனால் அது கொஞ்சம் கேர்ஃபுல்லாக இருக்கணும். பிகாஸ் நீங்கள் ரொம்ப நாள் கழிச்சு நீங்கள் மறுபடியும் ஏதாவது ஒரு ஸ்போர்ட்ஸ் விளையாடுங்க, நீங்கள் ஏதாவது இன்ஜுரி ஏதாவது ஆகிடும் உங்களுக்கு. அதனால ரெகுலராக பண்ணியிருந்தேன்னா அது வேற விஷயம். அது தீஸ் ஆர் சம்திங் தட் ஐ வுட் ஸ்ட்ராங்லி ரெக்கமெண்ட். ரெகுலராக பண்ணுறது வெரி இம்பார்ட்டன்ட். ஹெல்த்தியாக இருப்பீங்க. முட்டிக்கு சேஃப் எக்ஸசைஸ்லாம் இருக்குது, நிறையா இருக்குது. யூ கேன் டூ ஆல் தோஸ் எக்ஸசைஸ். சிம்பிள் வாக்கிங்கே வெரி குட். ஜிம்மில் போய் கொஞ்சம் லைட் வெயிட்ஸ் தூக்குறது இது எக்ஸலண்ட். ரெகுலராக பண்ணால் எந்த ப்ராப்ளமும் இருக்காது.
Thank you very much, Doctor. It was a very informative session. For appointments with Dr. Venkatramanan, you may reach out to 90031 51865. I repeat, 90031 51865. Thank you, Doctor. Thank you, viewers.
Thank you, viewers. Thank you very much for coming for this case.